Well, earlier this year, the health of country singer Randy Travis shocked fans. The 54-year-old was suffering from heart failure, but technology is helping him fight his battle. It's a technology used at the University of Minnesota and the focus of an event this week out at the State Fair. Thursday is LVAD Day. That stands for Left Ventricular Assist Device. It's a heart pump. And joining us this morning is Dr. Ranjit, a cardiologist specializing in heart failure, and Chris Lauer, an LVAD patient. Good morning to both of you.
Thanks. Good morning.
Thanks for being here. All right, doctor, we're going to start with you. Explain, first of all, what is an LVAD, what it does, and maybe who can benefit from it.
An LVAD stands for a ventricular assist device, and it's one option and rapidly becoming the standard of care for patients with advanced heart failure alongside with heart transplantation. And we have a couple of models of...
Yeah, this is it right here?
Yeah,
Gosh.
This is one of the pumps called the Heart.
All of that goes inside?
Part of it, and actually Chris has one of these implanted in him. Wow. These are the two currently available pumps, and they all have a cannula that goes inside the heart that drains blood, and there's a pump that pumps blood out through a graft that's hooked up to the ascending aorta. And there's always a cable that comes out from the body that connects these pumps to the battery pack and the controller. And Chris has one of these right here. So Chris has had one of these pumps in for a couple of years now.
And you say this is becoming more common, that people who have heart failure use
Absolutely.
these things.
Several thousand of these are implanted in the United States, and they have surpassed the number of heart transplants and is often becoming the go-to option for patients with advanced heart failure.
All right, wow, that's truly incredible. Technology obviously coming so far, such a long way. Chris, tell me your story and how you ended up with one of these.
About 11 years ago, I caught a virus. Unfortunately, I was on a business trip on a plane, caught a virus. It was like a flu. Instead of leaving my body, it attacked the heart and caused my heart to swell 3 times normal size. When the heart's bigger, it becomes a very weak pump and inefficient. It's the only muscle you should be working on getting bigger.
Right.
But, unfortunately, it was treatable for many years, but it progresses and gets worse. And I got to the point where I needed the next step of treatment, and that was coming to the University of Minnesota.
Wow, what's it like living with that? I mean, you know, to those of us who obviously don't have one, it seems cumbersome and at the very least a huge life changer.
It's kind of like, and I explain it to my children, is I get to be Iron Man, but I don't got the red and gold suit. I have all the mechanics inside, but no cool blasters or anything.
Is it difficult though? I mean, do you have to pay attention to it in any way, or?
I pay attention because obviously I have batteries that I have to keep going, and electricity that has to power this. So on days where there's storms or things like that, I get a little nervous. But I do have batteries. I run on basically 2 laptop-sized batteries for 12 hours at a time, and so I can swap those out at night. I plug into a wall.
Holy cow. Now, I have to ask, doctor, is this for those who are waiting for heart transplants, or just they can live with these forever?
The intention was as a bridge to heart transplant. You know, patients like Chris, without having a heart, you know, sooner than later are at high risk for dying. So the majority of these pumps are used as a bridge to heart transplantation, but they can also be used and are increasingly used for patients with advanced heart failure who are not candidates for heart transplantation. We refer to that as destination therapy. They live out for several years with these pumps, and these pumps can go on for you know, over 10 years.
Oh, okay, wow. Well, what are some signs of heart failure that you might can share with some of our viewers?
Some early signs are, you know, the increasingly difficulty walking, the inability to climb a flight of stairs, putting on weight in your ankles and swelling of the feet, bloating of the abdomen, difficulty sleeping at night, and, you know, being treated for a pneumonia and not getting better, some of early warning signs of heart failure.
All right, so obviously if you have any of those signs, you want to check with your doctor.
Absolutely.
Now, there's an event on Thursday out at the fair. Tell us about that.
We've had that for the last 3 years, and this is the 3rd year we're having it on Thursday the 29th, and we have, you know, models of normal hearts, diseased hearts. We have health professionals explaining how, you know, the pathogenesis of heart failure. We have models of these pumps. And most importantly, we have patients like Chris who have, you know, spending the day helping us educate the public about heart failure and these options that we have that are saving thousands of lives.
Well, it's a good education to get anywhere, certainly out at the fair when you're walking down the fairway there with your big old fried something on a stick or your bowl of fried something. Check in, make sure your heart's okay, and listen to the warning signs. Dr. John and Chris, thanks for being with us today. We appreciate it.